As we wait for the USA's next administration, some public health professionals are ready to make recommendations, whatever the result. It's in everyone's interest to have a healthier America, and the Trust for America's Health has a blueprint for how to get there. Nadine Gracia, president of Trust, joins me now. Thank you so much for being here.
It's a pleasure to be with you.
So let's talk a little bit about this blueprint.
Yes, so public health and the public health system is really at an inflection point, and it's so critical as a nation that we act. This is TFAH's 5th edition of our blueprint, which we release every 4 years for the incoming administration and Congress. The blueprint really, it's intended to be a roadmap for the Congress and administration that's going to be taking office in 2025 on how to improve health and well-being in the nation. And we've seen since the first blueprint report that we released in 2008 that this really serves as a document that's not only policy guidance for lawmakers and the administration, but it's also a rallying point for advocates who find consensus and agreement around the recommendations. So this is a blueprint that's a path forward on how we strengthen our public health system and how we improve health and well-being for the nation.
Who were the collaborators who came together to help put this all together?
Our report recommendations are really the result of convenings we've done with experts, with practitioners, with community members, as well as research to be able to identify some of the evidence-based policies and programs that will help to both protect and promote the public's health. So we've had organizations, 14 organizations that have actually endorsed the report, and many others that are helping to promote, raise awareness of the report and its recommendations.
All right, let's delve more deeply into it and find out what the top priorities are in the report.
Yes, so the report and the blueprint really address 6 priority areas. Those include how we ensure our public health system is actually ready to meet the growing health challenges of the 21st century through a strong and robust public health infrastructure and workforce. It's how we strengthen our readiness for health security threats. It's also how we promote health and well-being across the lifespan, as well as advance health equity, and then also addressing non-medical drivers of health. And lastly, how do we protect the scientific integrity and effectiveness of federal public health agencies?
It's so critical, but it's also expensive at times. So how do you ensure the funding?
Well, it's important to understand that the U.S. is spending the highest amount in terms of healthcare spending of high-income countries, and yet we have the worst health outcomes of high-income countries. Public health and prevention can actually help to change that trend. Public health is on the front lines of promoting the health and well-being of communities across the country. And we know that actually, when you look at measures like life expectancy, for example, many of the factors that have actually contributed to increases in life expectancy in the country are rooted in public health interventions. So when we invest in public health, that's actually a best buy. So our job is really educating our policymakers about the importance of increased and sustained funding for public health and prevention, because these are proven policies, proven programs that work, but yet we've had unsustained funding or more periodic funding that really hurts our efforts to be able to promote the health and well-being of the communities.
Clearly the people here are on the front lines. What would you say to them to inspire them to go beyond this meeting and really carry forth some of the recommendations?
Well, we are so encouraged by all of the conversations that are happening here at this conference, and just encourage public health professionals, read the report, share it within your organizations and within your networks. And if you're engaging with policymakers, to consider some of these recommendations as part of the policy priorities that you're working to advance, and to share your stories. They're the ones who know, they're in the front lines of communities, what the impact of policies like increasing and sustaining funding for public health or ensuring that proven prevention programs are in communities, the difference that it makes in promoting health, reducing disparities, and also helping to reduce costs. They're the ones that are the greatest voice to be able to champion this message.
Yeah, the policies are so important, but so are the people. Thank you so much.
Thank you for the opportunity.